how can it be that nurses in Washington state are trying to create protective equipment out of office supplies?
Well, unfortunately, that's the reality. We have a shortage of protective equipment, mainly masks, not so much for gloves, but protective gowns. Like you said earlier, we are there to do the job, and we're willing to do the job. All we are asking for is protective gear so that we can safely take care of our patients. Because if nurses and the frontline workers are not safe, our patients are not safe. There has been a lot of colleagues of ours who have been put on self-quarantine because we don't know whether they were exposed or not, or if they've gotten the virus. But if there's too many of us that are put out on quarantine, or we definitely get the bug, the virus, then there will be nobody out there to take care of patients. And I think it's not too much to ask our administration, our government officials, to give us what we need to safely take care of our patients. That's all we want. We cannot pick and choose who we want to care for. We want to take care of everybody, but we need to do the right thing. We need to have the protective equipment to safely do our jobs.
Zenny, many of the people infected now or who have been infected, especially early in the pandemic, might not have known how dangerous it was, and they might not have been taking enough precautions. All of you in the healthcare field know how dangerous it is, and yet you run right toward that danger. What does it take for you to do that?
Well, it takes a lot of courage, a lot of passion, and a lot of compassion for our patients, the vulnerable who need us when they're at their, very sad state of health decline. We need to be out there for them, because if we don't, nobody else will. And that's what we pledge for, is to take care of our patients, because there will be nobody there for them if we don't do it. And again, I cannot stress it enough that we are not scared of taking care of the infected patients. What we are scared about is that we ourselves are not protected. For all you know, we might be carrying the virus and, spreading it from patient to patient. That's why we want to make sure that we have the protective gear so that our patients are safe.